Hi, I'm Sarah Arney. I am a physical therapy student at Indiana State University. This is Becca, and we're going to be going over a cranial nerve assessment. So first, we're going to start with cranial nerve 1. This is a sensory nerve, the olfactory nerve, which is responsible for smelling. So I'm going to ask that you close your eyes and cover one nostril, and then tell me what you smell. And then do the same for the other side. And what do you smell? The next sensory nerve that we're going to be going over is the optic nerve. So this is responsible for vision. So we're going to be doing a Snellen test. So cover one eye and then read to me the lowest line that you can read clearly.
This is grade 10, FDPLTCEL.
And then cover the other eye and do the same. Read the lowest line you can read.
LEFLDPCT.
The next group of nerves we're going to be going over is cranial nerve 3, 4, and 6. These are all motor nerves. These are the ocular motor, the trochlear, and the abducens nerves. So first we're going to start by looking for ptosis of her eyes. So that's drooping of the eyelids. Her eyes are both symmetrical and open. Next, I'm going to be looking at the pupil's reaction to light. Good. Good. And then next, I'd like to see how your eyes move. So I'm going to ask you to follow my finger. I'm going to go back and forth, up and down, and then on the diagonals. And I'm looking to see smooth pursuit and even on both sides. So next we're going to be doing the trigeminal nerve. This is cranial nerve 5. It is a mixed nerve. So I'm going to do the sensory part by asking you to close your eyes. I'm going to touch this cotton ball to your face and tell me when you can feel my touch.
No. 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 No.
Good. Now I'm going to test the motor part of the nerve. I'm going to ask you to clench your jaw. And I'm feeling for the masseter muscle and the temporalis muscle. The next nerve we're going to go over is cranial nerve 7. This is the facial nerve. It is responsible for facial expression, and it also has a sensory component. So I'm going to ask you to raise your eyebrows. Yep. And then close your eyes as tight as you can. And then smile and frown. So for sensory, I'm going to see if you can taste the anterior 2/3 of your tongue. Yep. Next, we're going to be doing cranial nerve 8. This is the vestibulocochlear nerve. It's a sensory nerve, and it's responsible for hearing. So I'm going to say a 2-digit number in your ear, and I'm going to ask you to say it out loud.
24.
Yep. And then the other side.
84.
Good. Next, we're going to be doing cranial nerves 9 and 10. These are both mixed nerves, and they are the vagus nerve is cranial 10, and the glossopharyngeal is cranial nerve 9. So I'm going to ask you to open wide and say ah. I'm going to stick this in, and I'm going to create a gag reflex, or check it. Good. And then this is also responsible for the taste on the posterior 1/3 of the tongue. So stick your tongue out as far as you can. Good. Do you taste that?
Yeah.
All right. Then we're going to be doing the spinal accessory nerve, which is cranial nerve 11. I'm going to test this by seeing how well your trapezius works. So bring your shoulders up. I'm going to resist down. Good. That's a motor nerve. And then the final motor nerve is the hypoglossal nerve, cranial nerve 12. I'm going to do this by asking you to stick your tongue out and then wiggle it from side to side. Good. And then your final task will be saying goodbye to the end this cranial nerve assessment. Goodbye.
So next we're gonna evaluate some bristle organs. We're gonna start with palpation of the McBurney's point, which is assessing for acute appendicitis. So first I'm gonna ask my patient to lay supine and relax. Do you mind if I touch you?
Yeah, that's fine.
So she's gonna relax, and I'm gonna roll up your shirt. And I'm gonna palpate for her ASIS. So right here, and then I'm gonna find midway between that and the umbilicus. And I'm gonna palpate for the tender spot that she is describing. And once I find that spot, I'm gonna apply a deep pressure and then quickly come off of it. So I'll push and then quickly come off. And what I'm looking for is a rebound pain, so the patient describes pain more coming off of the pressure rather than when I'm initially applying pressure. So some signs and symptoms that would suggest me to perform this test would be if the patient describes anorexia, so they're not eating, or if they describe nausea or vomiting, if they experience epigastric pain that starts in the epigastric region and then moves to the lower right quadrant, and have tenderness in that area, if they have fever, if they have elevated white blood cell count, and if they have a left shift. So that is the palpation of the McBurney's point. Next, I'm going to perform the Murphy's sign test. This is a special test checking for if the patient has colitis. So first, I'm going to ask the patient to lie supine and be in a relaxed position. Do you mind if I expose your abdomen? So I'm going to put one hand on the posterior aspect of their rib cage. So I'm going to be posterior inferior of the margin. Then I'm going to use my other hand to find the subcostal space in the right upper quadrant. I'm going to apply a little bit of pressure, but then I'm going to ask the patient to deeply inhale, and as she does so, I will apply additional pressure. So can you inhale deeply? So what I'm looking for a positive test would be pain with that inspiration as well as the additional pressure and apprehension to the test. So next we're going to go over some signs and symptoms that a clinician might use to lead them to performing the Murphy's sign test. These are for acute and chronic gallstones. So first, the patient might have jaundice, which is yellowing of the tissues. It will first be seen in the eyes, the white of the eyes, and progress to involve the skin. This is due to the rising bilirubin levels. The patient might also experience some GI complications. So this could be anorexia, nausea, vomiting, and as the pathology progresses, they might have intolerance of fatty foods paired with belching, constipation, or diarrhea. The pain that they might experience would be tenderness in the gallbladder, which is located in the epigastric region or right upper quadrant. This could also be rib pain, hot rib. So that would be pain right here on the tip of the 10th rib, but can also occur on the 11th and 12th rib. The pain will increase on inspiration and movement. So if you can turn around, we're going to go over some of the referred pain of the gallbladder. So they could have pain in their right shoulder and scapula, and then as the disease progresses, they can experience pain in the mid-back, remaining in between the scapula. So those are some signs and symptoms to look for acute and chronic colitis.